Where we are today is because of what we've done in British Columbia. Over 55% of our eligible children have received their first dose. Over 90% of people have at least 2 doses of vaccine. And over 50% of people have got their booster dose. And that's something that we need to continue. And thankfully, we're starting to see now that transmission in our communities and the subsequent hospitalizations are starting to come down. We are in the place that we are. And we've made these decisions based on the best science, based on the data that we have of what's happening in British Columbia right now. And we are able to make the changes now as a result of the efforts that people throughout British Columbia have made to get vaccinated, to follow all of the public health measures, and to take steps to protect ourselves and those around us. So today we're going to continue that transition. Is there some way that you guys can advance this? There we go. All right. So let's move on to the next slide. And it is, as I said, because we did the right things for each other, and particularly because of the high rates of protection we have through immunization, that we are in the place that we are right now. And if we can move ahead. Yep. This is just some of the images, and we'll go through these quickly because we want to get to the meat of it. So the next couple of slides are reflections from people in our community of why and how important it was that they were able to get this protection, not only for themselves, but to look after those around them, and particularly, as we know, those who have been most differentially affected by this pandemic, including our seniors and elders. And if we go to the next slide, how important it has been in so many of our communities around the province that we've done this for each other, that we've worn masks when it's important, that we've stayed away when we're not feeling well, and that we've got vaccinated. So where we are right now, if we go to the next slide, is we are shifting our response to a long-term COVID-19 management strategy that's focused on those key things that keep us safe, including immunization, and focusing attention on the things that we do for ourselves based on our own risk and the risk in our community around us, and the specific actions that we all need to take to protect those most at risk of severe infection. And we know that remains our elders, our seniors, people who have immune-compromising conditions. But we also need to move into recovery as we're in this transition phase. We are not out of this pandemic in British Columbia, in Canada, or globally. And we know there will be continuing pressure on this virus to mutate into a new variant, a variant that may be more, may cause more serious illness, a variant that may evade some of the immune benefits that we have right now. But we need to continue to monitor as well the balance of our population health that the restrictions that we have in place have caused. And then we need to be ready to respond to the ongoing waves and troughs as we get through this next few months with our very high level of community immunity, and as we move into the next respiratory season in the fall. But our goals remain the same. If we go to the next slide, and that is to minimize the number of serious illness and people dying of COVID-19, and to protect our health care system. And importantly, to minimize societal disruption. And we are at a place today where we can take major steps to do that. We still have important tools, and we have more and more tools now. We know that immunization makes a tremendous difference. We also have data now that tells us that that booster dose protects not only from serious illness, but it also protects us from infection. It's not 100%, but good data here that's being presented even now by my colleagues at the BC CDC, Dr. Skowronski and her team, has shown that getting that booster dose gives you an effectiveness of 60% against infection with the Omicron strain. That's important. That means we'll reduce the chances of getting infected and passing it on to others. Our public health measures, some of which will continue, will need to continue for the years ahead. We've learned how important it is to stay home when we're sick, to wear masks on those occasions when we're around people indoors, wear our testing strategy, physical distancing in certain situations, and it may be important to develop, to keep our case and contact management systems going for the next strain of this virus that arises. We have all learned about infection prevention and control in healthcare, in our workplaces, and we will need to continue to manage outbreaks in settings of high risk of serious illness, whether it's long-term care or corrections or others. And increasingly, we have another tool of treatment that can prevent people who are at risk from having more serious illness. If we go to the next slide, BC is one of the most vaccinated jurisdictions in the world. And we also know from the modeling that we've done, looking at the seroprevalence studies that we've been doing systematically over the last 2 years, that we have a very high level of population immunity right now. And that's primarily because of vaccination and a small amount from people who've had a recent infection. We do know that an infection, particularly with Omicron, can cause a varying level of immunity that may wane quite quickly over time for some people. We do know as well that if you get infected with Omicron, on the top of having vaccine, that you get a very strong booster dose response from that infection, and you're very unlikely to have more than a mild illness. So those are the things that put us in a place right now where we can move ahead on some of the other activities. If we go to the next slide, we can see, compared to jurisdictions across Canada, that we have been effective in our approach. And this is just looking at how we have managed to come through the last few weeks with our Omicron wave. We have managed to keep our hospitalizations lower so that we can spread them out and manage and not overwhelm our healthcare system. And that's because of the measures people have taken to protect themselves and others. And our deaths remain low. It is the same if we compare ourselves to other jurisdictions around the world. In the next slide, where we see as well that we've been managed by the work that people have done collectively. If we go to the next slide again, this is just a comparison of the data that we presented, our modeling from the BC CDC modeling group that we presented on January 14th, when we put in the additional restrictions. And we can see that we have followed that trajectory for hospitalizations, and we're now starting to see the decrease in census, so people in hospital with a positive COVID test, as we would expect to see because we took the measures that we did. And if we go to the next slide, our modeling then shows us that we have the ability now, with the amount of immunity and the transmission patterns that we're seeing, to start lifting the restrictions that we've had in place, particularly the additional ones we put in place as we were trying to understand the impact that Omicron is going to have. So our next slide. Ensuring a balance in easing restrictions is the way that we have gone about this from the very beginning, using the data to make sure that we are doing as much as we need to do to keep things to find that balance between infections and opening up. So we are going to have an incremental easing of restrictions and orders starting tomorrow, and I'll give you the details of those in a minute. But there will be some things that will remain in place, and we will review those in detail prior to the middle of March, prior to spring break, and again before Easter in April. We know that for some people what we're doing today will be really fast and it will make them uncomfortable. We know as well for others it's not fast enough, and they would like to see things going back to as if the virus was no longer here. But the reality is that this virus continues to circulate in our community, and because we have such a high level of immunity through immunization, for most people that doesn't lead to serious illness or hospitalizations. And we need to respect that people need to go at their own pace, and businesses will need to go at their own pace, depending on their own risk. As well, our immunization campaigns will continue. As I've mentioned, we now have good data about how important that booster dose is, also for protecting against infection right now, but also for the future. In addition, very shortly, we should have new tools in new vaccines, including the Novavax vaccine and the Medicago vaccine, which are more traditional subunit vaccines that will be available for those people who have concerns about mRNA vaccines. And we're hoping to hear news about that in the very near future. And that will be yet another option to help people get through this phase and protect us going into the future. So what is going to continue on our next slide? The protective measures that we have used with success here in BC that will continue for now are our mask mandate in indoor public spaces. When we have this amount of transmission in our communities, and we know that those indoor spaces are where we can transmit more easily, that are riskier settings, that extra layer of protection becomes important. We also will continue to use the BC vaccine card as a way of ensuring that we're mitigating risk in those highest risk indoor settings. And we'll rely on the COVID safety plans with the important backbone of the COVID safety plans to allow people to return to offices and workplaces. And then starting on February 16th at 11:59 p.m., in the next slide, we will be removing restrictions on all of the restrictions on indoor personal gatherings. And that will mean that you will make your own decisions based on your risk and the risk in your family of who you will have over into your home and to have in vacation rentals and other properties. We are going to be allowing, again, indoor and outdoor organized gatherings. So those are those wedding receptions and parties and celebrations of to curtail or put on hold for the last few weeks. They will be with the mask mandate and the BC vaccine card be allowed at full capacity. And because of the amount of immunity that we have and the protection that we get through those, we'll be able to go to full capacity and no longer have those requirements of remaining at tables. So that means mingling and dancing and all of those other important things that we've missed will be back. The indoor seated events will go back to full capacity. We had put in that 50% capacity at movie theaters and arts events and sports events. That will go back to full capacity as we were before we hit this Omicron wave. Fitness centers, adult sports, dance and swimming will also go back to full capacity, and we'll be removing those restrictions we had on tournaments for adults. In this now as things are improving and the risk is going down. And importantly, in restaurants and our food and beverage serving orders, restaurants, bars and nightclubs will now be allowed to reopen and go back in terms of restaurants to full capacity with no limits of people at tables and going back to mingling and being able to have events in restaurants and dancing. And it is because we have those layers of protection through the vaccine card, through our masking, and through those COVID safety plans that we can go back to full capacity in these settings again. So for most people, that will start on Thursday morning, the 17th, although at midnight on February 16th, the orders that were in place will expire. So we do have some protective measures still in place. And as I said, these will be reviewed to see if any of them or all of them are still necessary. And we're committing to reviewing them again by March 15th and letting people know where we are then based on the data and the surveillance that we have. And again on April 12th, prior to the Easter weekend. So along with the masks and the vaccine card, we will be looking at the increasing visitation and looking at the restrictions that we have on additional social visits in long-term care. We'll be working with our school and child care and early childhood education on the reviewing of the guidelines for K-12 and child care. We'll be meeting with faith leaders to review some remaining restrictions we have in faith communities. And there's 2 orders on child and youth overnight camps and the industrial camps orders that we will be reviewing as well as we move through the next month. So that's where we are right now. I want to say how proud I am of people in British Columbia for stepping up and doing what you have done to take care of each other, to follow the guidance that we have. We are at an exciting and positive milestone, but we have We have all sacrificed and come through a lot in the last 2 years, and we want to move ahead slowly and cautiously and thoughtfully. And we need to do this together to make sure that we're respecting each other's comfort levels as we move into this, and we build that confidence to come back together again in so many ways that we need. So let's take this time to recognize our progress and all that we have done through this pandemic to turn the tide on COVID-19. Our long-term sustainable strategy about recovery, readiness, and respect. It's about moving slowly and thoughtfully and gradually getting back to all of the things that we love. It means all of us continuing to be accountable to each other, managing our own risks, and equally important, protecting those around us. We are on track and we are progressing well. So let's look to tomorrow with hope and know that optimism that we can increasingly start living with this virus without it disrupting so many aspects of our life. But we can't lose sight of the fact that we have some ways to go yet. The journey ahead will be a challenge and different for all of us. But if we continue to respect each other, to be kind to each other, we will get through this phase of it as well. Thank you, Mr. Dix.
See, this is thank you very much, Dr. Henry, and good afternoon. Today, I'll provide an update on BC's rapid test inventory, healthcare workers off sick last week, and an update on surgical postponements. First, I want to reiterate the gratitude to all British Columbians who have overwhelmingly done the right thing over the past 2 years, following public health orders and guidance, and most importantly, getting vaccinated. It's because of these efforts by all of us that we are where we are today. Regarding rapid tests, up to the end of February 11, 2020, BC has received 15,318,006 tests. Also, as of February 11th, we had deployed 7,231,358 of these tests to key strategic areas. This leaves a current inventory of 8,086,648. As noted in previous weeks, 558,648 of the current inventory are not suitable for deployment for takeaway or personal use, and these tests will continue to be used at the discretion of medical health officers in the appropriate settings to manage clusters and outbreaks. That leaves 7,528,000 tests that are suitable for self-administered use. In addition, there's approximately 2,876,470 tests en route to British Columbia. And now, an additional 9,964,710 tests are scheduled to arrive over the weeks to come, but are not yet in transit. While we await the additional 9.9 million tests, we will be working to deliver the approximately 10.4 million tests that have arrived or are in transit through the following allocations: 720,000 to COVID-19 test sites across BC to replenish their supply. As you know, they've already received millions. 200,000 to replenish supply at acute care centres for healthcare workers and health authority employees. 100,000 to support the testing of visitors and staff in long-term care and assisted living, in addition to the approximately 1.74 million they have already received. 300,000 to support rural, remote, and Indigenous communities. 300,000 for businesses and organizations. 3.8 million more tests kits to K-12 education. 2.1 million more test kits for the post-secondary education sector. These last allocations related to education mark an important shift, as students will be offered in coming weeks the opportunity to take home one 5-test kit for their and their family's future use if they were to become symptomatic. Assuming the in-transit delivery of 2.87 million tests arrive later this week, we also anticipate starting distribution at no cost to citizens to the broader community. We will begin with seniors, carrying on our focus on higher risk individuals, but will expand to the broader population as the inventory continues to arrive. It's important to remember, I know Dr. Henry will remind us, that testing continues to be something we do when we have symptoms. That hasn't changed. Increased test availability means that more members of the general population will be able to access tests to use to understand their own symptoms and illness and to take action to limit transmission to their friends, family, and work, including those at higher risk. I'll have more to say over the next week, and Dr. Henry and I will have more to say on the distribution over the next week. With respect to the impact of sickness on healthcare workers, we saw a decrease in the number of staff with short-term illness, off sick, 15,524 during the week of February 7th to 13th. By way of comparison, from the previous week, we had 17,158 healthcare workers off sick. That's 3,438 in Fraser Health, 2,932 in Interior Health, 1,612 in Northern Health, 1,538 in the Provincial Health Services Authority, 2,181 in Vancouver Coastal Health, 3,273 in Island Health, and 550 in Provincial and Interior Health. Proportionately, that continues to be a significant number, and while it has come down in the last couple of weeks, it continues to be higher than it normally would be this time of year. Just to be clear, this is not illness from COVID-19 we're talking about. It's all illness, including COVID-19. In comparison to similar periods in previous years, it's come down to about 20% higher. And now here's our surgical renewal update. Health authorities report 6,006 surgeries were completed from January 16th to 22nd. We want to talk about the most recent period from February 6th to 12th. Health authorities postponed 320 non-urgent scheduled surgeries. That's 70 in Fraser Health, 3 in Northern Health, 231 in the Interior Health Authority, 10 in Island Health, and 6 in the Provincial Health Services Authorities. No surgeries were postponed in Vancouver Coastal Health. All the efforts we've made to stop COVID's rapid spread, from using our COVID sense to getting vaccinated to consistently following public health guidance, have made a difference. Because of those efforts, where it's safe to do so, health authorities have been able to start again booking and completing surgeries that were postponed. We said patients would get calls to rebook their surgeries. They will, all of them will. And that is exactly what is starting to happen. Patients are starting to get their calls. Patients are starting to get their surgeries. There will continue to be some postponements because of staffing or the need to create capacity. But what is vital right now is we all understand that our work is not done, and you can see that it is not done. All of us need to keep making a difference that matters. And as we do this work, that we do so well, we make the essential difference in the lives of all patients who are waiting for those calls. And we think of them today, and all of the healthcare workers who continue to do exceptional work throughout our healthcare system. And with that, I'll invite the Premier back to the podium. We're happy to take your questions.